Hi, good morning, Mrs. Farr.
Hello, how are you?
I'm doing just fine. I'm Lori. I'll be your nurse today.
Okay,
I'm
great.
here to give you enema.
Oh, wow. Okay.
I know. We'll try to get it done quickly.
Gotta happen. All right.
To administer a cleansing enema, first provide privacy by closing the bedside curtain or the door to the room.
I have to lay your head down.
Okay.
With the side rail up, lower the head of the bed and then raise the bed to a height that's comfortable.
I have to uncover you, but I'm going to give you this blanket.
Okay.
Cover her with the bath blanket and pull the top linens to the foot of the bed.
Okay, good.
Okay? You hold the ends of it for me.
All
There.
right.
Okay, keeping your legs straight, just turn to your left side for me,
Okay.
please.
Have the patient turn onto her left side with her right knee bent.
Now,
Assist her as needed.
top leg and bend it a bit.
All right.
Perfect.
After donning gloves and lowering the side rail nearest you, place a waterproof pad under her hips and buttocks. Ask the patient to lift her hips if she is able, and tuck the pad under her.
Can you lift your hips a bit for me?
Yeah, I'll try.
Perfect. A little bit more.
Okay.
Expose only the rectal area and make sure you can clearly visualize the anus. Now separate the patient's buttocks and inspect the perianal area for abnormalities such as hemorrhoids, anal fissures, and rectal prolapse. Position the commode or a bedpan for easy access. Or, if the patient will use the toilet, make sure that it's available and that her slippers and robe are handy. To administer a commercially prepared enema, remove the plastic cap from its tip. If the tip is not pre-lubricated enough, apply more water-soluble gel.
Okay, I'm going to uncover you a bit.
After expelling any air from the enema container, separate the patient's buttocks and locate the rectum. Have her relax by breathing out slowly through her mouth. Then gently insert its tip into the anal canal, angling toward the umbilicus. Adjust the insertion depth based on the patient's age. For an adult or adolescent, insert it 3 to 4 inches. For a child, insert it 2 to 3 inches. For an infant, insert it 1 to 1.5 inches. For any patient, do not force the tip if you feel resistance. Continuously squeeze the container until all the solution has entered the rectum and colon. Then place toilet tissue around the tube at the anus and gently withdraw. To administer an enema using an enema bag, check the temperature of the warmed solution by pouring a small amount over your inner wrist. Then add it to the bag. Now raise the enema bag, release the clamp, and let the solution flow just until it fills the tubing. Then reclamp it.
Okay, Mr. Mays, we're going to get started with your enema.
Okay.
When the enema and patient are prepared, use a lubricant gel to lubricate the last 2.5 to 3 inches of the tip of the rectal tube. Then gently separate the patient's buttocks and locate the rectum.
Take a big deep breath.
Instruct him
Let
to
it out and
relax by
relax.
exhaling slowly through his mouth.
You're going to feel a little pressure.
Gradually insert the tip of the rectal tube into the anal canal, aiming it toward the
okay, sir?
umbilicus. As you would for a disposable commercial
Mr.
enema,
Mason.
adjust the insertion depth based on the patient's age, but do not force it. While continuing to hold the tubing in place, open the clamp and let the solution enter slowly, with the container at the patient's hip level. Then gradually raise the enema container above his anus. For a high enema, raise the container 12 to 18 inches. For a regular enema, raise it 12 inches. For a low enema, raise it 3 inches.
You let me know.
Vary the installation time with the solution volume as prescribed. If the patient has
Maybe just a few
cramping
more
or if
minutes.
fluid escapes around the rectal tube, lower the container or apply the clamp. When all of the solution has been instilled, clamp the tubing.
Now, Mr. Mays, we're just going to slide this out, okay?
Then place toilet tissue around the rectal tube and gently withdraw it. For either type of enema, explain that mild distension and abdominal cramping are normal.
I want you to stay on your side for a few minutes.
Okay.
You may feel a little fullness and maybe even cramping. That's all normal.
All right.
I'll be back in a few minutes.
Ask the patient to retain the solution as long as possible while lying in bed in Sims position.
All right, thank you.
Okay.
Place the call light within her reach and tell her to call if she needs assistance. Discard the disposable enema container properly, or wash a reusable container with soap and warm water. When the patient is ready, help her onto the commode or bedpan, or assist her to the bathroom.
Okay.
Remember to observe the character of the feces and solution. If needed, assist the patient with washing the anal area with soap and water.
Okay, Mrs. Farr. How are you feeling?
Oh, much better, thank you.
Oh, that's great. I'm just going to take one quick last look at your abdomen real quickly.
Okay. You've been
As
so
part
good.
of follow-up
Thank you.
care, assess for distension and ask if the patient's abdominal discomfort was relieved.